You've probably seen the name toxic shock syndrome before, right? Maybe on a warning label inside a box. But what is it really? Well, it's a sudden and pretty severe illness. But here's the most important thing you need to know: it is almost completely preventable. And really, understanding it is the key to keeping yourself safe. So let's break it all down. So picture this: an illness that can hit you with incredible speed, almost out of nowhere. It's serious, it's sudden, but the crucial part, the part we really want to focus on, is that you can prevent it. So what exactly are we talking about here? We are talking about toxic shock syndrome, or TSS for short. Now, it is a rare condition, but it's absolutely life-threatening. It all happens when some very common bacteria start releasing toxins into your bloodstream, and that can set off this devastating chain reaction in your body, leading to things like a super high fever, a very specific kind of rash, a dangerous drop in blood pressure, and in the worst cases, organ failure. Okay, so if TSS is caused by bacteria that are pretty common, what's the deal? What makes it so incredibly dangerous in these specific situations? To really get a handle on prevention, we've got to start at the beginning, with the root causes. Let's dig into where this danger actually comes from. It's super important to know that TSS isn't just one thing. It actually comes from toxins made by two different types of bacteria. On one side, you've got Staphylococcus aureus. You've probably heard it called staph. This is the one that's most often linked with tampon use, mainly because it can really thrive in that kind of environment. And on the other side, you have Group A Streptococcus, or strep. This one is usually the culprit when TSS comes from things like skin infections or surgical wounds. So the real key is figuring out what creates that perfect breeding ground for these bacteria to start pumping out their toxins. The most famous risk factor is using superabsorbent tampons for too long, but it is definitely not the only one. Really, any situation where bacteria can just multiply unchecked, like leaving a diaphragm in for way too long, or having an infected wound after surgery, a bad burn, or even the packing inside your nose after an operation, all of these can create the perfect conditions for TSS. And that brings us to what is honestly probably the most critical part of this whole explainer: how to recognize the warning signs. Because TSS moves so fast, knowing what to look for and acting on it immediately can, well, it can literally be the difference between life and death. The key word to remember here is sudden. TSS doesn't build up over a week. It hits you, and it hits you fast, usually with a really high fever. And one of the biggest telltale signs is a rash that looks a lot like a sunburn. It can be all over, but you should especially look for it on the palms of your hands and the soles of your feet. That's often coupled with muscle aches, redness, feeling confused, and a really dangerous drop in your blood pressure. And it is so vital to know that not all TSS is the same. Just look at the staggering difference in these mortality rates. Staph TSS, the type we often link to tampons, has a mortality rate of about 8%. But strep TSS, wow, it's tragically so much deadlier, with a rate anywhere from 20 to 60%. The symptoms can also give you clues. Staph TSS often leads to skin peeling a few days later, but strep TSS is known for causing severe, intense pain right where the infection started. This timeline really drives home just how urgent this is. Within just the first few hours, that high fever spikes. Then, within a day or two, the rash shows up and blood pressure starts to plummet. And in the days that follow, without immediate medical help, the body's organs can start to shut down. The speed of it all is exactly why recognizing it early is everything. So, what happens if you think you might have TSS and you get to the hospital? Well, the good news is, once it's identified, medical teams have a very clear, very aggressive plan to fight it. Let's take a look at how they step in. Treatment has to be aggressive, and it has to be immediate. It starts with getting admitted to the hospital, usually straight to the ICU. The absolute first priority is to get that blood pressure stabilized with IV fluids and medication. At the same time, doctors are working to remove any potential source of the infection, like a tampon or wound packing. They start powerful antibiotics right away, even before they know for sure which bacteria it is. And in some cases, surgery might be needed to clean out or even remove infected tissue.
Seeing that intense treatment plan really highlights why this next part is the most empowering one. Because while the treatment is a huge deal, prevention is actually surprisingly simple. So let's go over the actionable steps you can take to stay safe.
For everyone who uses tampons, it all just comes down to smart habits. First, use the lowest absorbency you actually need. Staying away from the superabsorbent kinds is a really good idea. Change them often, at least every 4 to 8 hours. It's also great to alternate between using tampons and pads, just to give your body a break. And of course, simple hygiene like washing your hands before and after, that's totally non-negotiable. And this right here, this is a critical warning for anyone who has survived staph TSS. Your body doesn't always build up a strong immunity to those toxins, which means the risk of getting it a second time is very real. And that's why the medical advice is crystal clear. To stop it from coming back, you should not use tampons or diaphragms ever again. All right, we've covered a ton of ground here, right? From what causes it to the symptoms, the treatment, and how to prevent it. So let's just boil it all down to the absolute must-know takeaways. If you don't remember anything else from this, please remember these 3 things. Number 1, TSS is rare, yes, but it is an extremely serious medical emergency that moves incredibly fast. 2, know the symptoms. A sudden high fever combined with a rash that looks like a sunburn is a medical emergency. Get help right away. And 3, prevention is your superpower. Being smart about hygiene and how you use products is without a doubt your best defense. We really hope this explainer has armed you with the knowledge you need to stay safe. This is the kind of information that can truly save a life. So if you found it helpful, please share it with people you care about. For more essential health info from us here at MediByte, make sure to like this and subscribe to the channel. Thanks for watching, and stay informed.